Welcome to Bite Size Dental Marketing. Today I have Ian. Ian, it's always a pleasure, buddy. I love the bite.
Good to be here, Eric. Thank you. It's good to be back.
So we talked about undersold. We've talked about oversold. When is SEO not the answer for practice? Like when should you
Never.
focus on
It's
other?
never not the answer,
That's
Eric.
that's probably true. That's
I'm
probably
gonna,
more true.
as,
All right,
as the head of SEO of this company, I'm gonna say it's never not the answer.
never.
No, that's
Uh,
I'm kidding. That's good. It's a good question. It's a good question. So the first thing that comes to mind is practices, or there's two things that come to mind. The first is practices that want immediate results.
mhm,
Again and again, Google has said to us, and the entire SEO industry has been very clear about this, that SEO is not going to be your solution for immediate results. That's where paid media comes in. And that's why it's good to have a
mhm, mhm.
holistic approach to your marketing and your digital marketing online. It takes at a minimum 3 months to sometimes 6 months to really see a difference in whether or not you're actually achieving what you want to achieve with what you implemented in your SEO strategy in the
Now,
previous
do,
quarter.
I have a question for you on that.
Hmm.
You said
Hmm.
3 to 6 months. Okay. I agree. That's what Google and anyone, I'll say respected in the industry says.
Hmm.
Do you also mean, I know there's startup practices that get started and, SEO is a big deal for them, but it's also, when you add, let's say you start doing implants or you start doing sleep apnea, is there also the lead time on, like, let's say we have a fee for service established practice that start doing sleep apnea. Do you also think you have that lead time on when you start marketing sleep apnea for them?
Depending on how competitive the area is for that specific service, you're going to vary in your SEO success.
Hmm.
A good example of this is we have a practice out of Lugov, Texas, that in the area it was not super competitive. The dentist started offering dental implants, and within a couple of weeks, with great content and consistency, boom, we're up in that Google Map pack for dental implants near me. But in an area where you have many established practices, let's say the DFW area or any number of big cities where there's a lot of competition, you can't just rock up as the new dentist in town and expect that you're immediately going to rank up. And
Hmm.
that's where
Hmm.
that consistency then, and over periods of months at a time, to be consistent, to stay on top of what your competitors are doing and improve on the content you're putting out, to improve on what they're doing, that's what Google will eventually reward. So to answer that, Eric, I would say definitely based on the competition in the area, it will determine how quickly you can have SEO success for those type of practices.
Hmm. Okay. Now, how do you, what are some of the predictors to tell you if you're in a competitive area or not? Is it dentists per population? Is it, what are you
Mhm.
doing out there to determine how? Because I'm going to say that, we've seen the rise of this general dentist doing implants, more dentists are doing sleep apnea than ever. How do you determine how competitive your area is?
So the first thing that I do, Eric, is I'll just pop into Google quickly, dentist, Rockwall, Texas, or dentist, Dallas, Texas, and then
Hmm.
see what pops up. I'll go to Google Maps and see what pops up. Even before I go to my software to look at this specific area, I just want to see in a broad stretch. And if I see Google usually indicates with the little red dots on the map. And if I see that 30, 40 different red dots are popping up, I know, okay, this is a highly competitive
Hmm.
area. This is not just going to be a walk in the park to try and outrank these people. Um, I'll then immediately start essentially going more in depth, where I then pull out software like SEMrush, or I pull out software like Bright Local to do a more uh, uh, a closer look at the competitive area, whether that's in that dentist, the zip code, because what I would usually want to start with is what is my competition in my zip code and how can I beat them? Once I beat my zip code, I say, okay, what is my competition now in the city as a whole? And then I start to work on my strategy there. Because slowly but surely building my authority and
Hmm. Hmm.
essentially moving outwards,
Yeah.
is a good strategy that's worked for us in the past multiple times.
And and even at the zip code level, at the city level, at a broader level, it's really that creation of good content and making sure that you're incorporating like the longer tail keywords. So sleep apnea, CPAP replacement,
Hmm.
sleep apnea, for moderate sleep apnea in, 50-year-old male with moderate sleep apnea.
Hmm.
Like
Hmm.
it really is just sort of the building out the content and making sure that you incorporate those long tail keywords.
Exactly. That's one of the main strategies where we figure out what are people looking for in that area that's not being answered by the competitors.
Hmm.
If I can answer the questions that competitors are lacking, Google is more likely to serve me to a user that's looking for that search term on their platform. It's,
Hmm.
I
Hmm.
mean, it's not rocket science. If nobody else is giving an exact answer to what this person is searching, why would I not serve the one person in that city or in that area that is answering that question? And that's where long tail keywords become so important, because we're directly matching intent. And that's how you can start knocking out your competitors, as you just
Yeah.
rightfully said.
Yeah. No, I think, common sense is very uncommon. I think consistency in SEO is more important than working hard.
Exactly. I mean, I was just saying that to you the other day. It's I'm happy.
I didn't invent
I'm
that.
happy. I'm happy you remembered that, Eric. Trying to steal my own line from me. No, that is, I mean, staying consistent in your efforts, Eric, is one of the fundamental pillars of how we do SEO, and that's
Mhm.
why we're successful at what we do. Is it's not just about feeling that I'm putting in a ton of time, putting in a ton of hard work, and I'm going to send the client email of
Yeah.
all of
Yeah.
this
Yeah.
incredible work that we're doing. It's about consistently every quarter. I'm building on my strategy from the quarter
Mhm.
before, and by doing that, you eventually reap those results, and you see those benefits.
Yeah, no, we see it all the time. That you ask, a client calls and says, what are you doing for me? And we see agencies do a ton of busy work
Hmm.
that doesn't really fit into a strategy. They're just sort of slamming
Doing
content onto
work,
the
yeah,
site,
doing work
just
to do
doing
work,
work.
yeah.
And then they're like, look at all this work I did, but it's not part of a cohesive strategy that, to your point,
Exactly, and
yeah,
that's where a
okay.
client should be asking their marketing or their dental marketing company, okay, but how does this tie into the overall SEO strategy for my practice? And
Hmm.
those are
Hmm.
the important. That's one of the most important questions that a practice should be asking, because it's not just about how much work did you do for me this quarter. It's how does this build to work towards what we want to achieve? Because
Hmm.
for my SEO team, the most important thing is we are setting a strategy in place to achieve something, whether that is push the service that the dentist favors most or that has the highest production. That's the strategy we're working to. And quarter over quarter, we have set pillars in place that says we will do this now.
Hmm.
We will see what happens. Next quarter, we will be doing this. We will see what happens and then build to a point where over a 6 month to a year period, if you look back, then sleep apnea traffic has gone up substantially, or impressions for sleep apnea has gone up substantially. And that then shows us that we're having progress in a targeted strategy SEO wise, and not just doing work to do work for the
Hmm.
sake of showing the client what we've done.
Yeah, for the sake of checking a box. No, I
Hmm.
really like the strategy that you guys have deployed of targeting the gaps between the big keywords and where the competitors are lacking, because
Hmm.
I do think you're almost banging your head against the wall to chase down like the highest, keyword
Good
first,
point.
because
Hmm.
I really like how you guys have carved out niche longer tail keywords that still have traffic, and then you build to the biggest competitive terms.
To build
Yeah, no,
authority.
that.
That's exactly what
Mhm.
it's about. You show Google, I am an authoritative uh, entity, rather an authoritative entity on this product, and that's where EAT that Google talks about so much: expertise, authoritativeness, and trustworthiness. That's
Mm.
where that ties in so much. Like, do you represent those pillars? And
Mhm.
especially
Mhm.
in something what we call in SEO, or the type of content that Google refers to is your money or your life.
Mhm.
That's the medical profession on Google falls under the bracket of your money or your life. And if it falls into that bracket, Google is especially more
Mhm.
on the lookout for people that are not putting out accurate information, that are not sticking to
Right.
that sense of expertise, and then penalizing them. So that's a part of a dental practice that they should
Well,
also remember.
we see that by putting Botox on some websites that Google
Mm-hmm.
wants, a license and accreditations and things like that to not flag, the ads that drive the
Exactly.
traffic to the site. But no, you know what continues to amaze me in the dental field is the number of dentists who come to us and say, "I'm the best dentist at X in my area. Why am I
Mm-hmm.
not ranking?" And it's like,
Mm-hmm.
man, I, I promise you, I don't care how good you are. I mean,
It's
clinically
just a
at
part
it,
of it. It's just a part of it.
right? From a marketing standpoint, I care that there's 10 other people who've been marketing and producing content for 2 years, and you
And
just
saying
showed
they're
up
the
today.
best, and they're
And
also saying that they're
yeah,
the best.
they're definitely marketing themselves as the best. I know you can't say I'm the best, but
Mm-hmm.
they're
Mm-hmm.
they're, they're def. It continues to amaze me that a dentist will come to us and say, "I'm going to start doing sleep. I want to be number one in 30 days." And I'm like,
Yeah.
bro, there are 10 other dentists that have been marketing this for 2 years now.
Mm-hmm.
I promise you, Google views them with more authority. And when you talk to
Exactly.
them about it, they're like, "Yeah, but they're not very good. We're using the same product."
Yeah.
Okay, they
Yeah.
have a 2 year head start. Like we can catch them, but it's not
Mm-hmm.
a 30-day effort.
Yeah, no,
Yeah.
I very well said, Eric. I completely agree. And the best way to explain that or to simplify that in SEO terms of how I understand it is if you're a dentist and you're going to start offering a new service that's important to you,
Hmm.
you need to understand that Google has other consultants essentially on this topic that has been on their website for, and other businesses I'm referring to as consultants, because that's essentially what these practices are
Hmm.
doing. They're providing to Google information on the topic because they are experts on the topic. Google trusts them more because they've been there for much longer. It's like friends. If we build up a friendship with someone, if I know you for 5 years and you've not failed me yet and you have a clean slate, I'm going to trust you way more than the person that I met 2 weeks ago, that I know nothing about, that doesn't have a presence in my community, that a lot of people have not told me about. And that's exactly how your
Yeah.
online effort should work. If you then say realistically, uh, hey, dental marketing company X, this is a service I want to start pushing. What can you guys do for me? I know it's going to take time, but I want us to start putting the necessary steps in place for me to have decent traffic on this in a year in terms of organic traffic to my website. That's a
Right.
realistic goal that can be set, and then setting those expectations, having a realistic outlook means that at the end of this product, the dentists themselves will also not set themselves up for failure. They'll be
Yeah.
more likely to be happy with the outcome.
Agreed. And I think as you're building your SEO, I think that the other teams are focused on paid media, making sure you're ranking for it, making sure we
Hmm.
have content for it, making sure we're marketing to internal patients. I feel
Hmm.
like one of the biggest missed opportunities when a dentist rolls out new technology or they roll out a new procedure is they want to market to everyone out in the world and tell everyone in the world do it, but they really need to start marketing it internally first. I think that does two things. Number one, I think that the existing patient base already has trust, but two, I think it lets the dentist, and I'm not talking about clinical skills. I think it
Hmm.
lets the dentist hone the skills that she or he is talking about with the patients. I think that,
And people that trust you already,
and people that
people that
trust
are
you
already in your
already,
arsenal.
yes,
Hmm.
in a
Hmm.
safer place, you are now talking about your approach to sleep apnea. You're testing little lines. You're testing jokes. You're testing the
Perfecting your
approach.
craft. Yeah.
Yeah, you're
Yeah.
you're perfecting the soft skill of the craft through
Hmm.
this, and that way, when you do acquire someone who doesn't have the same trust as an existing patient does, you have repeated this a number of times that you're more confident in selling to them, such increasing the treatment acceptance rate of the new patient.
Hmm.
Yeah.
Hmm. I completely agree. That's a nail on the head there. I completely agree.
Mhm. Well, Ian, as always, I love
As
chatting with you.
always. Yeah.
As always, handsome devils, um, and that's your bite of dental marketing.
How?